There is a huge labor shortage, but there's also lives at stake. So we have to make it work.
Some may not be able to work in a Quebec hospital like this one if they're in direct contact with patients for more than 15 minutes and they aren't fully vaccinated by October 1st. The Quebec government announced a vaccine mandate for the 10% of Quebec healthcare workers who have yet to receive a first or second dose of the vaccine.
It wasn't a huge shock to the team, but there still is, I would say, 15% of my team that is refusing to get vaccinated. We have calls lined up this morning with them to try to explain the situation. Some of them are hesitant because they have medical reasons, certain respiratory issues, that they can't be vaccinated.
85.7% of Quebecers are inoculated with at least one dose or have taken their first appointment, 75.6% with 2 shots. And of the 500 employees working at nursing and home care agency Elite Comfort, several have yet to receive a first dose.
In my employees, I would say it's maybe 1% of them are nurses, and the balance are more immigrant PABs that are weary of the vaccine or who are uncertain of the safety of the vaccine.
At the Nomadic Nurse Agency, all 30 employees on Nurse Melanie Jade Bouleris's staff have been vaccinated.
When I had to enter my job, we have occupational health departments for a reason. And it's to ensure the safety of the staff when they're being exposed to certain viruses.
The province is exploring consequences of refusing mandatory vaccinations, like suspending healthcare workers without pay, some calling it extreme.
We do not feel valued as healthcare professionals, and I feel putting a suspension is not really setting the tone of how we're valued, given how we have been feeling a certain way for quite some time.
Last summer, when the government decided not to give vacation to the healthcare workers, a lot of them just quit. So now we're getting into the 4th wave. Are we going to have more people quitting?
Many fearing this will push the already short-staffed healthcare sector further into a labor shortage. A parliamentary commission is being set up next week to debate the vaccine mandate with groups involved.
We're wondering, is it the right way to get the 100%? Can we be more positive, giving incentive?
I understand freedom of choice, but this is the job that you chose. It's an exceptional circumstance of a pandemic, and we have to protect those that can't protect themselves.
In Montreal, Alyssia Rubertucci, City News.